Good evening. Thank you for joining us for this virtual community town hall addressing the COVID-19 pandemic in the greater Fredericksburg region. My name is Xavier Richardson. I'm the Senior Vice President and Chief Development Officer of Mary Washington Healthcare. And on behalf of our foundations, I would like to thank the community for their very generous donations towards the efforts of our associates and in taking care of the many members of our community. For over a century, Mary Washington Healthcare has been committed to improving the health of the people in our communities. We take this commitment very seriously, and we know that many of you have questions and concerns about the COVID-19 pandemic. Tonight, we're here to share what we know about COVID-19 and what we're doing to keep you and our community safe and healthy. During this town hall, we invite you to ask questions of our panel of experts throughout the conversation. And now, I'll turn the program over to our moderator, Lisa Henry, who will introduce our panelists.
Thank you, Xavier, and welcome everyone. Please join me in welcoming our panelists, Dr. Mike McDermott, President and CEO, Dr. Chris Newman, Chief Medical Officer, and Eileen Dohmann, Chief Nursing Officer. To start this evening, I'd like to ask Dr. McDermott to talk with us about the Mary Washington Healthcare COVID-19 data. Dr. McDermott?
Thank you, and thank you everybody for taking some time out of your evening to join us. We like doing these town halls, sharing with everybody in our community the experiences we are having here at Mary Washington Healthcare as we help our community navigate this COVID-19 pandemic. I like to start by sharing some of the data that we use internally from one of our dashboards that we use. The data shows that you can see here on the top left, that's the total number of patients who we are currently caring for in our Mary Washington Healthcare hospitals, Mary Washington Hospital and Stafford Hospital, that have tested positive for COVID-19. So we have 18 individuals currently that we are caring for. Below that, 73 individuals that we have cared for in our community that we have discharged home, back to their homes after needing inpatient care for COVID-19. We do know COVID-19 is a life-threatening disease for many patients, especially those with comorbid conditions, and we have seen 12 patient deaths associated with COVID-19. Over to the right of this dashboard, you can see some of the graphs that we follow, and it can be kind of hard to decipher here, but the more time you spend with them, the easier they are to interpret. But up on the top right, there's an orange line. That's some of the state data of current patients hospitalized within the hospitals throughout the Commonwealth of Virginia that have been diagnosed positive for COVID-19. Underneath that, the yellow line, and this data goes back about 8 weeks now. This is from the middle of March until now. The yellow line is the number of patients we have had in our hospitals who've had a positive diagnosis of COVID-19 on each day from really the middle of March through now. And you can see we have averaged typically anywhere from 20 to 35 patients or so throughout the COVID crisis. Below that are there's a red line, that's the number of patients we have in our intensive care unit at any time, and that's been typically anywhere between 5 and 15 patients. And then there's a green line, which is the number of positive test results on any given day from all of the testing that we're performing here at Mary Washington Healthcare. The long story short with these graphs is there's a lot of good news in here. We have been well within our capacity to care for members of our community that have needed inpatient hospital care to help them fight COVID-19. And so we've never exceeded our capacity. We've never seen any of those scenarios that you've probably seen in the news described in New York City, in the greater New York area, or in Italy, where really the number of patients that needed care have just overwhelmed their healthcare system. Here in our Fredericksburg region, we've kept it well within our capacity to care for everybody that needs care. We created that capacity way back in the middle of March by stopping scheduled procedures and elective surgeries here at our hospital. And I know I hear in the community a lot of times people thinking that with these very ill patients in our hospital, we must be doing very well financially through this COVID-19 pandemic. And it's really exactly the opposite. I can tell you Virginia hospitals, by stopping the elective surgeries and the scheduled procedures and creating all the excess capacity in our hospitals, which was the right thing to do to be prepared, Virginia hospitals are losing about $25 million a day, about $750 million a month as we go through this COVID-19 pandemic. And there's also, sometimes I hear people talking about, oh, there's been an increase in reimbursement in caring for patients that have the diagnosis of COVID-19. And although that's technically true, it is still estimated that hospitals, because of the intensity of care required to care for these COVID-19 patients, hospitals lose on average $8,000 to $10,000 caring for every COVID patient that we see. And so it's just not true that this is somehow a financial windfall for hospitals. It is exactly the opposite. It's having a significant negative financial impact on our hospitals throughout the United States. And here at Mary Washington Healthcare, we share our share of that. So just wanted to talk a little bit about the financial impact of this COVID pandemic on hospitals and health systems, and it is negative.
Thank you, Dr. McDermott. Now I'd like to go to Dr. Newman to talk a little bit about plasma donation and convalescent plasma therapy. We hear a lot about that in the media, and we've had a few questions before the town hall. Can you talk to us about that?
Yeah, I'm happy tonight to talk and open up talking about a potentially life-saving treatment for COVID-19 that has shown great promise across the nation in treating COVID-19 patients, and that's convalescent serum. And this is where we take the plasma, which is a blood product, from individuals who've had COVID-19 and recovered. And that plasma holds the antibodies that can attack the virus. And we're now infusing that into patients, and it boosts their immune system, and we're seeing promising results from this. Here at Mary Washington, we've been using this in our intensive care unit to some great success here preliminarily. But this is a very, very scarce resource, and it can sometimes take upwards of 7 days to receive a shipment of plasma for a patient who is critically ill in our intensive care unit. For that reason, we're really strongly recommending anybody who's had COVID-19 and recovered to consider donating plasma through the Red Cross. It truly may save a life.
Thank you, Dr. Newman. And now for Eileen, if you could talk to us about some exciting news here at Mary Washington Healthcare that we're announcing here tonight, coming up next week.
Monday. So, you know, one of the things that we've talked to you about is seeing that we're seeing less patients coming to the hospital. And we think that that probably is related to people being fearful that the hospital is full of COVID. And as we've explained to you before, nothing could be further from the truth. Our COVID patients are isolated on specific units. And so we're very much prepared and provide a safe place for patients to come and receive care. But we also know it's not just fear that might prevent someone from coming from the hospital. We've not allowed visitors in our facilities for the last several weeks, and we know that's hard for someone who may be dealing with a health issue with the thought of coming to the hospital and not having a loved one with them. Or for that loved one to bring someone here and to say goodbye to them in the parking lot, not knowing when they'll see them again. And that separation can really create a lot of anxiety and a lot of angst for the patient and the loved one. So we're starting Monday, we're going to make a change in our visitor restrictions, and we're going to start slow because we want to make sure that we can stay on top of the number of people that we have in our buildings, that we can really do this in a very controlled way. So starting 12 midnight Monday morning, in our emergency departments, one visitor will be able to accompany a patient into our emergency rooms, all three. So here at Mary Washington, the freestanding, and at Stafford. And that one visitor will be allowed to stay with the patient in their emergency department room for the duration of their stay in the ED. What's also going to happen on Monday is for those patients that are inpatient, so in the hospital at Mary Washington and at Stafford, so these would be adult patients, not in our ICU and not on a COVID unit, but for all of our other patients, that from 12 noon to 8 p.m., we would also be encouraging and allowing each patient to have one visitor. What we're asking is that one visitor be the same visitor each day. So just like when you come to the hospital and we ask us, who's your primary point of contact, who's the person that you want us to give updates to, that's likely probably going to be the same person that you will want to designate as your one visitor. And so that person will be able to come in on our inpatient units, so in our regular units, from 12 noon to 8 p.m. We'll encourage them to stay in the patient's room. You don't have to stay for the whole 8 hours, so we welcome you to come for a 1 or a 2 hour visit and to be able to be with the patient. Now, in both situations, in the emergency department and on the units, if your loved one, if the patient is going to, say, go downstairs for a test, we're going to ask that the visitor stay in the patient room. And so that would be one request that we would have. And then the other thing that we're going to make sure that all of our visitors, we'll ask all of our visitors to work with us on, is that when every visitor comes to our entrances, they're going to be screened. We're going to ask a couple of questions. We're going to check your temperature, and we're going to make sure that you have a mask. So if you have a mask, please bring it with you, because we're going to ask that you wear that mask the whole time that you're in our facilities. And so you're going to be masked. One of the things that will be important when patients register, so when they register in the emergency department or they register upon admission, they're going to be asked the question of who is that one visitor. So we'll know in our electronic medical record who the visitor is, so that when your visitor comes to the entrance of the hospital, one of the questions they'll be asked by security is for your name as the patient as well as for their name as the visitor. And we'll be able to cross-reference that and know that you are the visitor for this particular patient. Now, that doesn't change our visitation in pediatrics or the NICU or at Snowden at this time. But it does allow us to welcome visitors to come when you're bringing your loved one to the emergency department, or if you're in the situation where you have someone who's going to be admitted to the hospital, that you can actually visit them each day from 12 noon to 8 p.m. So we're excited about the change. We've actually missed having visitors in the building, and so we welcome having you back in the building with us. And most importantly, we know that it's very important to our patients to have their loved ones with them, and we also know it's important for our families and loved ones to be able to see and be with their patients during some of their most vulnerable times when they're sick enough to be in the hospital. So we're very excited about what Monday will bring. It'll be a change, and so there might be some bumps in the road, so please bear with us. For those patients that are already in the hospital, so don't arrive on Monday but have already been here, the nurses on the floors will be asking patients, who is your visitor? So we can make sure that that visitor's name can be registered, so when they check in at the front door, we'll have that name in the electronic medical record. So we're excited for what Monday brings. It'll be great to have visitors back in the building, and it will also be comforting for all of us to be able to know that we've allowed patients to be able to have their loved ones with them.
Thank you so much, Eileen. And just to recap for our viewers, that starts at midnight on Monday morning in the emergency department, and at noon to 8 p.m. for inpatient visitation. We'll have all those details on our website over the weekend and on social media for anyone who needs some more, has some questions. Thank you. One of the things that Eileen mentioned when she was talking was about delayed care. So Dr. Newman, can we talk a little bit about what is going on in our community, the stories we're hearing, and the risks that are involved with patients who have delayed their care?
Yeah, this is more than just anecdotal. Within the last few weeks, we saw back-to-back patients coming to our emergency room with ruptured appendixes. We are seeing patients coming that have had chest pain at home for several days and delayed care, and by the time they're getting to our emergency department, they've had a heart attack several days ago and have advanced heart failure. There are, over and over, we are seeing patients who are concerned about coming to the hospital, delaying care and having bad outcomes. And again, nationally it's being reported that the numbers of patients dying at home has greatly increased, and that can't be truly attributed to just coronavirus. So it's very, very important for us to provide an environment where patients are willing to come back and receive care. I really think there were two obstacles for patients in making that decision or in staying away. One is safety. They hear anecdotally that we're overrun by coronavirus patients. They're afraid that they may catch it, that they may get sick. That is not true. This is an incredibly safe environment. As Eileen spoke, our coronavirus patients are all isolated in specific units, and we have negative airflow systems, HEPA filters so the air's not circulated, a lot of screening procedures. Everybody's getting a temperature check at the door. We're all wearing masks within the facilities. So there's many things going on that show that this is a safe environment. And just to really emphasize that, something that I'm very proud of, one of the things that I've been most concerned about is our frontline staff, our doctors, our nurses, our associates working every day with the COVID patients for fear that they may get sick. And we have now just crossed about 4 weeks without any of our associates or physicians who've been caring for COVID patients that have contracted this illness in the hospital. In fact, the few associates that we have had test positive have gotten it outside the hospital. So I think that's very important. And then the other thing that I think is more than just anecdotal, as we've talked to patients, why they aren't coming to the hospital, they're afraid to be here alone. When you're sick, you're scared, you don't know what's going on. It's very hard to be isolated from your family or from a loved one when you're sick. So we made the calculated decision to allow visitation now in a safe manner so that we can address both those problems. It's safe coming to our hospitals, and with the visitation now you won't be alone. So we strongly encourage patients to come back to the hospital and seek care.
Thank you, Dr. Newman. Eileen, we've had a question for clarification on the visitation. What about elective surgeries and outpatient procedures? What is our plan there?
For our outpatient procedures, we're not going to make a change right at this time. We'll see how things go next week for our emergency department patients and our inpatients, and then we'll reevaluate outpatients. And really, if you think about that, what you're used to if you come for an outpatient procedure and a loved one comes with you, they wait for you in a waiting room. And that doesn't really meet our requirements as far as social distancing. We don't really want to create those sorts of environments where a group of people are sitting in a small enclosed space. And so for right now, we're not going to make a change for our outpatient visitation. But I will tell you that just like everything else that we're doing, we're continually going to be reevaluating that. So as we see how it goes next week with our emergency department and inpatient visitation changing, we'll continue to look at, are there other ways that we can loosen some of those restrictions? We want you to be back in our building visiting your loved ones, but we need to make sure that we do it in a way that keeps everyone that's in this building safe.
And I think one of the things we have talked about internally is how do we manage social distancing in small waiting rooms. So I think that's part of some of the things we're working on now is how do we space people out appropriately if they're waiting during a procedure. Right. Thank you. We've had some testing questions, and one of our viewers has asked, can we describe the testing process from the time of the test through the results? What can that look like to our consumers?
Yeah. Well, in the outpatient realm, we are still doing the drive-through testing. And this is safest because you're outside. This is not a gimmick. It's actually being done for safety, safety of the staff doing the test. So in an outdoor fashion, they use a swab and get a sample. It generally takes anywhere from 24 hours to up to 4 days at the longest for those results to come back. We do have some very limited in-house laboratory capability to do some testing with a 45-minute turnaround time, but we only have access to about 7 to 10 tests a day with that in-house capacity, and we're working very hard to be able to increase that, because I think that turnaround time being shorter is very critical, particularly for inpatients or people waiting a procedure. But for our elective and its scheduled procedures, we are doing testing on everyone roughly 4 days in advance so that we ensure they're not an asymptomatic carrier of coronavirus when they come into our facilities and have a surgery or a procedure or an imaging test.
I have just another kind of follow-up there on the testing is all tests are not the same when we talk about COVID-19 testing, especially now. The test that Dr. Newman just described is the genetic test, the molecular test that is done to see if you have COVID-19, the virus, actively inside your body. And that's a very, very specific type of test done with a swab. So if you had a test done with a swab put in your nose, that is a genetic test to see if you have the virus. There are new tests coming out called antibody tests. And those aren't exactly the same as the genetic tests that are being performed. The antibody test test your blood to see if you built up antibodies to having the COVID-19 virus previously. And so if you actively have the COVID virus, you can't get an antibody test to tell you whether you have that, because it takes several weeks of having the virus in your body until you build up the antibodies. So there can be a lot of confusion out there now, and I see it in our community when people talk about testing. Just recognize all COVID-19 testing is not the same. There are different types of tests, and they play different roles in how we evaluate our patients. So I think it's very important for everybody listening to realize that. If you had a blood test done, that's not the same as testing you to see if you actively have the COVID virus in your body.
And there's great fear with these antibody tests that the results are going to be interpreted or used in the wrong situations. Like, we've heard anecdotally somebody coming to the doctor having, symptoms of COVID, getting the antibody test, it's negative, and they think, well, I'm okay. No, in fact, that person may very likely have active COVID and be infectious. They just haven't had time to develop the antibodies. Or I hear people being cleared for work because they have the antibodies, or perhaps, oh, we don't need as strict PPE or masks, and they can go back to work in certain situations. But we do not know that this antibody confers immunity yet, or if so, how long. So there's going to be a lot more we need to learn about the antibody test in order to interpret the results safely. All we can tell at this point is it's surveillance, that your body has been exposed to COVID probably 8 to 14 days previously, and we can use that for surveillance purposes, trying to get an idea how prevalent this has been in our society and our communities, but it is not meant for an active diagnosis.
Thank you for that clarification. We actually were getting a lot of questions about antibody testing and types of testing, so that's very helpful. One of the questions that did come in about antibody testing was, hey, I may not know that I had COVID. Can I get the antibody test to determine if I can be a plasma donor? Would that be something people can do?
That's an incredibly appropriate way to do this. And in fact, that's what would happen. If you believe you've had COVID-19, they will test your blood for antibodies to see if you have the antibodies. That way you can donate the plasma and potentially provide life-saving treatment to somebody here in our hospital with COVID.
And one of our viewers asked, we're testing pre-screening COVID-19 for our outpatients. Are we doing that for some of our inpatients who have to have a procedure as well?
We are. Yeah, some of our high-risk procedures we are testing in-house as well. Some of the other things we've started to do with testing is moms-to-be. At around 38 weeks, we're asking moms to get tested, because that's we're seeing an increased number of asymptomatic carriers of COVID, and when you're delivering, there's a chance of shedding that virus and infecting others. So we're testing moms at around 38 weeks. If you have a scheduled C-section or an induction scheduled, we're testing those individuals, but also procedures within the hospital we are testing as well.
Thank you. And are there any community antibody testing sites yet?
Yeah, the antibody tests are now readily available through labs such as Quest. We are doing, we're going to start doing the antibody tests here through our lab, and we have that capability. Because of the confusion around what to do with the results, that's why we've decided to be a little careful of who we provide that test to. Starting next week, we are looking to provide that antibody test to anybody who's been one of our frontline staff. That would be nurses, associates, physicians in our ED, our ICU, our cohorted units who've cared for COVID patients, as a surveillance mechanism to see how many people may have been exposed in those high-risk situations. We hope to then make the test available for other high-risk individuals, such as some of our city workers, our first responders. So some of that will be going on, and then maybe open it up broader to our associates throughout the system. And that's really just to control the results and understanding what we do with them and educate those. But you can go see your physician if you are concerned. Your physician is capable of ordering this through many commercial labs at this point.
And just remember, there's no real hurry to have the antibody test. Yeah. It's not the test you get when you think you have symptoms of COVID-19 to tell you whether you have COVID-19 or not. That would be the other test, the genetic test, the swab test. The antibody test is just a test that there's really no hurry to get it done.
Sure.
I would let a little bit of time go by until we make sure we have really, really reliable antibody tests that can give you some good data with good messaging as to what that means for you. So no hurry. We're working on that here. It should be rolling out within the next several weeks at the latest to make sure we have a very, very high quality antibody test to offer to our community with the right messaging to go along with it for what it means.
Thank you, Dr. McDermott and Dr. Newman. I appreciate that. We've asked, well, switching gears a little bit, we have had a question on what services are actually open now. There's some confusion about what is considered an outpatient service that's open, asking, you know, are there labs open and can I get an x-ray? So is there, one of the panelists here could take on what services are we offering now and what can't you get?
We've broadly opened up almost everything at this point.
It's all open.
It's all open. So we have certain sites for patients who have COVID or have symptoms of COVID to keep everyone else safe. We are directing them to certain facilities, but otherwise you can receive all of your care at this point throughout our health system.
We know what to do when you get here. Just get here.
Yeah, that's right.
And there are some questions that have come up about just donating in general. We have heard that there's some blood shortages, that donating blood, regardless of whether you're donating plasma as a COVID-19, is still important. Yes?
Critically
Absolutely.
important.
Correct.
Very
Please
important.
donate blood. Yes, very, very important.
And I will say that we have learned that the American Red Cross is requiring you to schedule an appointment to donate blood for their own safety measures as well. So you do go online to be able to do that. So another question, we've had someone ask, they're very concerned about the 65 and over. You know, we've heard a lot that they're a high-risk group, especially if they have underlying conditions. So one of the questions was, are they surviving? How are they doing for those that are over 65?
Well, we've had 77.
Yeah, 73, I think, individuals that we've cared for with COVID-19, many of those over the age of 65 who have recovered and we've been able to discharge home. So yeah, there are success stories even for those over the age of 65 that have COVID-19 that do recover. Obviously, we do know that age cohort, especially if you have the comorbid conditions and you have a severe case of COVID-19, can lead to the more difficult outcomes. Yeah. But that's not everybody by far.
So, you know, we do have, we've treated a lot of patients who have been critically ill that are younger, that don't have these comorbidities, but they have all been able to be supported and survived here. And we're lucky that's the case. The 12 fatalities or mortalities that we have had, most have been over the age of 80, and a few others had very serious comorbid conditions. So they were not unexpected, but we do have young, healthy people who have been here intubated in the ICU on a ventilator and very, very sick, but we have luckily been able to support all of them, and they've left the hospital.
I think it's also important to note, not every COVID patient that comes to the hospital ends up in the ICU.
That's right.
There's actually a very small percentage of them that end up in the ICU. So just like you hear, there's a lot of COVID in the community, and a small percentage actually end up in the hospital, and even smaller percentage end up in the ICU. So we've had very great success in those that have ended up in our ICU that have been able to fully recover and have left the hospital. Yes. We also have, though, a much larger number of patients who have actually come to the hospital, never had to go to the ICU. Were managed on our medical unit during the time that they had the virus, and they were successfully discharged. So it doesn't mean when a COVID patient comes to the hospital, you're on a fast track to get to the ICU. We've had, you know, of the COVID patients that we've cared for, most of them have not gone to the ICU. And I think for those that have, a very high percentage of them have had other comorbidities or been significantly older even than 65.
And when you talk about patients of all ages, we've heard a lot in the news lately of a specific syndrome with pediatric patients, a pediatric inflammatory syndrome, I think it's called. Can you help us understand that, Dr. Newman?
So this is something we don't know a lot about it quite yet, but we are seeing dozens of reports of children who are getting very critically ill with multi-system organ failure. They're calling this pediatric multi-system inflammatory syndrome. And we believe that this is related to previous infection with COVID-19. We have not seen any cases here in the Fredericksburg region yet, but we do have connections with Children's Hospital, and their physicians provide pediatric care here at our hospital. And we've been in conversation with them, and at Children's National, they've had 5 patients there with this syndrome. So it's something that we're beginning to learn a lot more about. Throughout this whole pandemic, we've actually had 2 children hospitalized here at Mary Washington with COVID, but both were discharged in good condition and have recovered.
It just goes to show you that this coronavirus is very serious in every single age group, right? And you can become very seriously ill by being infected by this coronavirus regardless of your age, right? So that's very important for everybody to recognize.
Thank you for that clarification. Another question submitted was in the outpatient areas, how are we controlling the amount of people that are coming into the waiting room? And are masks mandatory in those areas as well as in the hospital?
Yeah, we're recommending masks throughout all of our facilities for patients and our employees, our associates, our physicians, our nurses. So we continue to do things to make it safe, to limit number of people in our waiting room, such as that you check in, you can wait in your car, and they can text you when it's time, when there's a room, when you can be roomed. So there's a lot of efforts on many different levels to make sure it's safe and that you're not in a tight quarter with many other people.
And I can tell you, walking around the building, the darkest parts of our building are waiting areas, right? So the surgical waiting area, dark, nobody in there. The waiting areas for other testing, we're not having people waiting in waiting rooms.
Yeah.
Thank you. Another question came through on how we're doing on PPE. And I know, Eileen, you sit on our Innovation Council, and we often are looking at unique donations. So if you could talk about PPE and donations in general.
Sure. Well, you know about our mask challenge, so we've done a really great job with having masks. So we have a great supply of masks that we're able to make sure and to ensure that everyone in our buildings is wearing masks. Through our Innovation Council, we've gotten lots of suggestions or ideas from people in our community as well as within the organization of things that could be made and donated for us to use, particularly in some of the areas where we have challenges with PPE. One of those areas is actually disposable stethoscopes. So one of the things we do in our isolation rooms is a stethoscope is left in the patient room. So there's 1 per patient room, and they're disposable. They get discarded when that patient is discharged. What we've encountered in the last couple of weeks is a shortage of disposable stethoscopes. And so through our Innovation Council, we've had several members of our community that have 3D printers say that they think that they could create a disposable stethoscope from a 3D printer. Now, when I first heard that, I did scratch my head a little bit and think, how can you do that? However, I'm excited to tell you that we're on our 3rd prototype right now of a stethoscope. The first one I brought up to our ICU and asked the nurses in one COVID room to test it. And their first bit of feedback was, we don't hear anything. It didn't seem to work. The second one was, it kind of hurts your ears when we put it in. Third one, though, has seemed like it's been quite a charm in that they're reporting that it's comfortable to use and the sound is great. And so it appears that we can create disposable stethoscopes with a 3D printer. So we're now going back to the person who suggested that, and we'll do a little bit more testing to make sure that all of our users come back with saying yes, that they attest to the same thing. And then we'll be asking for them to be produced, and that will be just great, because then it gets us back into the situation that in every isolation room, you can put a disposable stethoscope in that room for anyone that's in there caring for the patient to use. So pretty exciting, not what we certainly set out to do, but a great way for us to partner with people in our community, in our organization that have the resources and the talent to create such things. So we're pretty excited about what the disposable stethoscope from the 3D printer is looking like, and expect that it won't be too long before we can actually have it in patient use.
Thank you, Eileen. We were having a lot of questions around physician groups. Is it safe to go back to the physician, and will they be opening up? Mary Washington Healthcare has a large physician practice network. What's happening there?
Yeah, we are open and we are wanting to see patients. We do not encourage anybody to delay care at this point. We have a lot of safe practices, so you can come in person and see your physician. We strongly encourage you to do so. But if you're concerned that you do not want to leave your home yet, or you're concerned about going out in the community, we have very easy to use telehealth capabilities. So you can have a video visit and still receive care with any of our physicians at any time. And we have same-day availability for most physicians at this point, so please see your doc.
Thank you. And Dr. McDermott, I'd like to aim this question at you. You sit on the VHHA's COVID response team and have worked closely with the governor here in Virginia. We're getting a lot of questions of, are we ready for phase 1? And is Mary Washington Healthcare ready for phase 1?
Yeah, I will say that I have a lot of confidence in the governor and his administration, because I know they're being data driven and looking at all the data behind the decisions that they're making. And that's where we want to be. We want to be looking at data and reacting to the data. And I think some of the tactics that you've seen the governor and his administration do, delaying the opening in Northern Virginia, I believe just announcing just a few hours ago they're going to be delaying it in the Richmond region as well. Yeah. They're doing that because of the data that they're seeing. And being responsive to the reality of what is occurring. And so as long as we follow that data, I think it is safe to take the steps that are being proposed, as long as we're being honest with ourselves, and if things don't go as expected, we react to that and go back to do what we need to do to keep everything within our capacity to care for those patients and in our healthcare system. We need to remain within our capacity to care for everybody. And so as long as we're doing that, reacting to the data to keep us within our capacity to care for everybody, I do have confidence that it is time to take these steps. But let's do it in a responsible way. I mean, all of these steps still require social distancing. We can all still wear a mask and be good examples when we're out and need to go outside of our homes. So make sure we're doing this in a responsible way. I think it's the first baby step forward.
Thank you. We've had some questions on testing capacity. Now, while we're going ahead and doing screening for outpatient and elective scheduled procedures, and for those that are in the hospital, what about all people? Is there ever going to be a point where anybody could get a COVID test seasonally or necessarily? If
you have COVID symptoms, you can get a test now. So for everybody who is having symptoms of COVID, you will be tested with one of the molecular genetic tests, the swab test, to see if you actively have the virus in your body. So we have that capability to do it now. Now there is a role to do that sometimes more broadly through populations, so we can see the incidence of asymptomatic disease and other sorts of things. We don't have that capacity currently here in our Fredericksburg region, I wouldn't say, but we do have the capacity to test everybody who has symptoms, as well as everybody who needs to come into our system for the scheduled procedures and other sorts of procedures where they're coming into our hospital. We're testing all of those individuals too, to make sure they're not bringing COVID into our facilities, and that we are doing those procedures in a safe manner.
Thank you. One viewer has asked, have we reached our max capacity at any point during the last 10 weeks?
No.
Nope.
Not even close.
Not even close.
To our max capacity on our floors, in our intensive care unit, we've never been close to reaching our capacity to care for members of our community. We've never been even near that threshold in any way.
In fact, many times initially we were at 50% of our traditional number of volumes for patients in the hospitals. So half of what we normally see. So, yeah.
Including our emergency departments.
Including our emergency departments, which is our concern, that people are avoiding care.
Thank you. And what about well visits? We've been hearing some things in the news where parents are forgoing vaccinations for their kids or delaying because of COVID-19. Is it safe for people to go back and get regular checkups?
Absolutely, absolutely. Strongly encourage that. Our offices are safe, our physician practices are safe, our hospitals are safe. We're doing everything we can to keep folks safe.
And one of our viewers has asked, when are our lovely volunteers going to return?
We wish we could tell you when. And again, it's that the whole focus is controlling the number of people that are coming in from the outside into the building, because any one of us could be an asymptomatic carrier and have COVID and not know it. And so the whole reason why we screen and we mask people coming into the building is you may have COVID and you don't know it. And so we're responsible for making sure that everyone that is in our buildings is safe. And so our volunteers, as much as we terribly miss all of you and are having to do so many things that we have a much greater respect for everything that you've done. We miss you greatly. But this is as much for your protection as the protection for everyone in the building, as we don't want to do anything that puts anyone at risk. And so you're part of us. You know, you're the associates that work for this organization that don't get a paycheck. But you're in a critical part of what we do every day. And I would love to be able to say, please come back tomorrow, but I can't. That would be irresponsible. Let us work through each of the steps. Let's start with some easing of some of the restrictions of our visitors. Let's look and see what happens. Let's watch what happens over the next couple of weeks in our community. We just need to be very careful because the safety of everyone that's in our facilities is of the utmost importance.
I think we just got one of our most generous posts that this team should handle the nightly news. You guys are positive approach and are using the language that's reassuring and informative, so we really appreciate that. Every time we do these town talks, we get questions about, I hear about this or I hear about that, and one of them that we got tonight was there's the conversation going on of a correlation between the flu shot and a COVID-19 false positive. So we know that all the time we're hearing all these. Are these conspiracy theories? Are these just these scare tactics? What's going on? What can we do to get people to know where to find the truth?
Now, I think the places to go for the truth are, Johns Hopkins has a great website for coronavirus and COVID-19, the disease, the testing. You can read all you want about the antibody testing, the genetic testing, what the FDA has approved for emergency use. The Johns Hopkins website, I think, is a great resource for anybody to look at. It has lots of data that we see nationally, so it's tracking and following the data of what is occurring everywhere. The Virginia Department of Health is a great website. The Virginia Hospital and Healthcare Association, the VHHA website, is also a great resource. The Centers for Disease Control. I think if you stay in that sphere of very reliable information, real data being updated daily, if you stay in those places, you're not going to fall off into the kind of the netherworld of conspiracy theories and other sorts of rumor, innuendo, and just things that aren't true. So stick with the truth, stick with those respected websites. There's still a lot of uncertainty, right?
Yes.
There's a lot we do not know. We have got to be comfortable with that. We don't have to make up an answer for everything we don't know yet. I think that's where it gets a little risky. We need to deal with reality as it is and with the uncertainty that exists as well. And I know that can make people uncomfortable and fearful, but I think accepting reality like it is and really welcoming that is the best place that we can be. Stick with the well-respected websites for your data. Yeah.
It's great advice, thank you. We've actually reached the conclusion of our questions, so I'd like each of you to give us kind of your closing thoughts for the evening. So Eileen, if I'd like to start with you, of any message you'd like to send to our community.
Sure, I guess tomorrow is a big day for us in phase one. And I guess I would encourage everyone in our community to keep in mind that there are some very simple things that you can do to keep yourself safe and to keep your loved ones safe. The number one cardinal rule of infection control and prevention is washing your hands. And so we call it hand hygiene in our world, but it's good hand washing. And you can never overwash your hands. So washing your hands frequently throughout the day. When you're out and about, come home, wash your hands. Wearing a mask. And as uncomfortable as that is, keeping in mind that, I think, Mike, you've said it each time we've been together, wearing a mask is that if you happen to be an asymptomatic carrier, that you wouldn't be spreading to the people that are around you. And that's really a sign of respect and caring. And it shows the community that you're doing your part to care for others. Well, if we all did that, we'd be a pretty caring community. So phase one and some of the changes that we'll see coming tomorrow and over the weekend doesn't mean that we change being careful. And so hand washing, wearing a mask, social distancing. This does not mean that it's time for us to get back to gathering in close, tight quarters. Keep doing the things that you've been doing. Let's make sure that this phase one change is a small change, and we sort of take those baby steps. You know, we hear there's lots of news out there about resurges and peaks. Let's not create one. Let's do the simple things that we can do: wash our hands, social distance, wear a mask, to do the very best that we can to take care of ourselves, but also to take care of our neighbors.
Thank you, Eileen. And Dr. Newman, any closing thoughts?
For me, the theme of the night for me is safety and the safety of our healthcare facilities. Everybody's heard me say this several times over the last week, but I feel safer coming to the hospital every day than I do going to a grocery store. And that is not a knock on our grocery stores. They're doing a lot of things to keep us safe. But a hospital is a different environment. We have negative airflow. We have air filtration systems that are keeping the air safe and clean. Everyone coming into our facilities is screened with a temperature check. Everyone is masked in our facilities. People coming in for scheduled procedures or outpatient tests are getting screened with a coronavirus test before coming into our facilities. We have enhanced environmental services and cleaning procedures on top of what is traditionally a hyper-clean space. I mean, hospitals are hyper-vigilant about cleaning in the first place, and we've upped our game tenfold. So it really concerns me when I'm seeing week after week people coming in with end-stage situations because they were afraid to come to the hospital or didn't come to the hospital and avoided care. Please don't avoid care. COVID is not a storm that's going to be here for 90 days and be gone and we get on with life. I fear this is going to be with us for a while, so we can't delay that. We have to learn how to take care of COVID and live with COVID and do other things safely as well. So please come back to the hospital. Don't delay care.
Thank you, Dr. Newman. Dr. McDermott, your closing comments.
My closing comments are, Mary Washington healthcare workers are amazing. I'm lucky enough to be able to work every day with Chris, Eileen, and thousands of other members of our teams that are just as amazing as Chris and Eileen are. And our healthcare workers are amazing, and they are heroes. But everybody out there listening to this today also is a hero in a way, right? You are paying attention to the social distancing that we've asked everybody to do, following the stay-at-home orders. Many of you watching this are probably also being model citizens, wearing masks when you're out and about in our community to show that you care, like Eileen said. And so my closing thought will just be a thank you to all the heroes that are watching this broadcast here tonight. Thank you for tuning in, for being interested, and thank you for what you're doing for our community.
Thank you, Dr. McDermott. We got a flurry of heart loves on your comments, so I think they're feeling a little heroic.
Good. They
All
deserve
right.
it.
And so on behalf of Mary Washington Healthcare, thanks to our panelists for providing your expertise this evening. We also appreciate you joining us to learn about COVID-19 in our community and sending in your questions. For the latest local COVID-19 information, stay tuned to the Mary Washington Healthcare Facebook page and visit us online at mwhc.com. Good night.